Hi, I'm Dr. Rob Cushman, the Medical Officer of Health for the Renfrew County and District Health Unit. I have great news for you today, but also have a request. I'm asking for your patience. The good news is that cases have not been this low for more than a month. We're now averaging a case every 2 days. This is fantastic. And on the flip side, and maybe one of the reasons why, is we have now given over 100,000 vaccines in Renfrew County and District. In fact, those with a second dose now marginally outnumber those with a first dose. This is great news. And we'll be going at the rate we're going. Anybody who wants a second dose will be able to get a second dose by the end of the month and maybe even earlier. This is terrific news. So here's what's happening, and this is why I need your cooperation. We did cancel appointments beyond July 18th because we knew with the added number of doses, we're looking in the neighborhood of 10,000 a week if the supply continues. You never know, but we're hopeful. If we continue at this rate, most people should be vaccinated by the end of the month, if not maybe a week before. So this is great, but it requires your patience. So here's the approach. As of today, we fixed our vaccination registry appointment IT, and you can go online and you can make an appointment for yourself or someone else at a clinic that's closest to you, your preferential clinic. Secondly, we are encouraging people who have not yet had a vaccine to come in. This is for first dose. A lot of these people are between the age of 20 and 45. In fact, roughly only 50% of these people have been vaccinated. So we will allow these people to come in as walk-ins, and this is great. Equally, if you're over the age of 75 and you need a second dose, you can also walk in. So this is great. So appointments for everybody except first doses for whoever you are, mostly in the 20 to 45 age group, and second doses for those over the age of 75. On top of appointments and walk-ins, we also have a weekly extra dose sign-up sheet. And this is very helpful because we've had some cancellations and we've had some no-shows, and we often can phone people. So if you want to, you can sign up to this extra dose list. These are our extra doses that we have. If you live within 20 minutes or so of a clinic, and you can get there quickly, put your name on this list and we will phone you. So this is terrific. Now, what I would say is, remember, you need to allow the time, the 4 weeks between doses. Secondly, remember, after a second dose, you're not fully immunized for 2 weeks. In fact, today is my 15th day after my second dose, so I'm ready to go. I'm as well immunized as I probably will be without maybe a booster, which might be forthcoming in, let's say, 6 months or so. But even though I am protected, this doesn't mean I can go out and party and get in large groups. Again, we have to be very careful. We have to be vigilant. We are going to have a fourth wave. The real issue is how well is it going to be contained? And what's the variant? And how transmissible is it, and how effective the vaccines are. So again, I encourage you to be patient, but look for opportunities to get that second dose or that first dose. But also, again, remember, restrict your activities. Don't get into large groups outside. And when you're inside, masking is essential. And pay attention, because it's only by being vigilant that we can get back to near normal. And if we really do this well, we can open up schools in the fall and get back to a pretty normal existence, a new normal by Labor Day. Thank you very much.